There are two really main types of cellulite. Number one, the fibrous type, where it's really thick indentations, very, very prominent, and they're almost like thick. And then you have more of the softer cellulite, more rippling skin, thinner skin. It's associated with skin laxity or volume loss. So there's two very different types of treatment approaches for these different types of cellulite. Here are some at-home things that you can do for a cellulite that actually work. Number one being massage. Two, there are certain topicals over the counter that help. And then three, there are some oral supplements that may help as well. One of the biggest questions I get is if massage works. And believe it or not, it actually does. You know, with cellulite, you have this like microcirculation and lymphatic that's almost impaired. So by going in and massaging this area, it increases that circulation to that area, which is always a good thing. And number two, it actually gets rid of some of that like congested lymphatic fluid. And so that's why visually, when you see yourself after a massage or a lymphatic massage or going in with one of those tools, it really does help visually. Does it help long term, and does it help like the etiology of like why that's there? Maybe not, but I do think it's worth doing. There are lots of tools out there. From Skinny Confidential has one that's almost like, it's called La Spoon, and it's almost like a square type, and that one looks really easy to use. And then there's a few, Skin Gym has one, and there's just a few on Amazon. Just make sure it's like thick enough and that you're not going in really hard and bruising yourself. As far as topicals for cellulite, the two that actually work the best include retinols and caffeine. These have been studied the most. And with something like retinoid, you want to make sure you're not pregnant while you're using it. And what that does is it stimulates collagen, right? And that's what we want while we are dealing with something like cellulite, especially kind of the rippling part. And caffeine has actually been shown to really help. So some of the ingredients that you're looking for in products, just make sure they have those ingredients and massage them in so you get like a 2-for-1. And oral supplements that may help cellulite. So you want to look for things, of course, you want to make sure you have a healthy diet, right? Some diet rich in antioxidants. There are some supplements that you can take. Fish oil has been shown to help with cellulite. Collagen supplements, believe it or not, has been shown. And that makes sense because studies on collagen supplements, the ones that are actually good, so Vital Proteins is one that I recommend to my patients sometimes just because it's sourced, I think, well. It helps with elasticity and collagen stimulation. So do I think that this replaces like sunscreen or something for anti-aging? No, but for the way of cellulite, there was a study that showed that you had to take at least 6 months to see some type of improvement. So it doesn't hurt. The two main things that we do at my office that have the best results for cellulite, number one, if you have the thick fibrous type of cellulite, so deep indentations, by far subcision is the best. So subcision is when I'm actually going in, you're numb, so it's very tolerable. I go in and I'm basically releasing with a little blade or needle, releasing those fibrous bands that are causing this like network where the fat is kind of getting pushed up through them. So by releasing that like fibrous network, you're releasing that fat so it's not pressured and pushing up and creating indentation, so it smooths it out. Oftentimes for the best results, I like to go in and inject something like Sculptra, which helps stimulate fat and collagen in that area, or we can do traditional fillers, but that is by far the best. And number two, the best treatment for the rippling type of cellulite is radio frequency microneedling. So what this does is it stimulates that collagen. We really want to improve the dermal, which is the deep skin, and the epidermal integrity. And so that's why something like radio frequency microneedling is nice, because it can really strengthen that top layer of skin, but also go deep, because you do want it to go at least 3.5 millimeters deep to really help stimulate that collagen, so that I've seen the best results from. And then if someone, of course, has a combination of those things, or they have a little bit of in between, I do both of those treatments, sometimes the same day or sometimes I split them. If there's any follow-up questions, definitely reach out to me on Instagram. It's Derm Approved Podcast or Dr. Sheila Derm. And let me know if you guys want me to do a part 2 for season 2. I'll see you guys later.